Numbers are still going upwards, and unfortunately there's one country that's dropped out of the list of having good control, and unfortunately that's us. We're in fairly good company, unfortunately. If you want to call it a second wave, Japan, Hong Kong, Israel are the other three countries that are, if you look at their charts, they're following the same path as ours. It's jumped back up again. And there are a few places that have still got perfect control. So Iceland, Ireland and New Zealand. And what do they have in common? They're islands. So we're an island. We haven't quite got there yet, but that gives us some hope that they've been able to do that. So if we look at the world situation, as I said, rates still going up. 1.8 million more confirmed infections this week, and it's probably many more than that, and a lot more death. In Australia, we're now pushing on to 14,000. So we actually stalled at about the 7,000 mark for quite a while there. There were several weeks where it just drifted along, but this week, more than 2,500 more cases. Predominantly Victoria, as we all know, and New South Wales, a reasonable number themselves. For us here in South Australia, 3 more cases this week. And there's been quite a few things changing. I mean, if we went back even 6 months, would we have thought the army and drones would be patrolling the Victorian border? I mean, it's ridiculous, isn't it? An internal Australian border currently has army troops and drones and police officers. Apparently 400 SAPOL members at least are deployed to the border to try and control this border. So the border is currently closed, and as of this Wednesday, will be closed even harder. So even as South Australian citizens, after Wednesday, won't be able to come back very easily. As we know, the Greater Melbourne area is locked down. I was wrong last week, it's not $500, it's $200 if you're not wearing a mask. In New South Wales, they've responded to their increase in cases by decreasing the number of people who can go dining together. So if you're going to a restaurant, it's a smaller number. We've talked about our singing here today. Well, in Sydney, they're actually being asked not to sing in church services. They haven't made it a rule or a law, but they're actually recommending that anything that increases transmission should be avoided. So I think we're pretty glad not to have that here. For South Australia, there's actually a couple of changes coming this Wednesday as well. Weddings and funerals are going to be dropped back from being open Saturday, depending on the size of the place, to down to 100 again. So far, no change in how many people we can have here for our meetings, which is good. But yeah, you can see, if you look at this chart, you can see the lockdown which happened on the 9th of July. So for comparison, when we go back to the first lockdown, 23rd of March, within 7 days was a noticeable downturn, and within 10 days it was really clear that things had changed. And if you have a look at that chart, you can see that we're 15 days in, and the chart still shows us going upwards. And if you actually look at expert commentary on this, and it's a little bit hard to find expert commentary that wants to comment, it's at least a week before we're at our peak, and could well be a month before we actually see the peak number of extra cases per day. And remember, the death rate for that is still sitting at least 1%, and we seem to skate past the fact that for every person who dies, there's somewhere between 10 and 20 who will have some leftover major health issue. Our practice is still looking after somebody who had COVID 3.5 months ago, and who still can't climb a set of stairs. Not in their 80s, they're in their 30s. So this is an illness which is still really causing us trouble. And why is this one so different? Why is this lockdown not doing what the last lockdown did? Well, in the last lockdown, it was actually pretty easy. We knew who we thought was suspicious for infection, and so you knew who to isolate, you knew who to trace, you know who to test. And at the moment, it actually could be anyone. And the reason that South Australia with 3 cases, and you think, well, that's pretty trivial. We're talking about a couple of thousand across Australia. The reason South Australia is already starting to twitch and move backwards to being a bit more careful is that it only takes one person spreading it. And I think Sydney's recently had a churchgoer who went to a couple of church services and a funeral or 2 funerals or something. And so they've been exposed to, or they've exposed several hundred people, just the one person. And that's the sort of thing that we're trying to work out how to avoid when we look at this. So if you look at these charts, you can see that the case count, the new cases are jumping upwards to back where we were in early April. But if you look at the other one, you can see that in March and April, there was almost no locally acquired cases, whereas now we're moving to a new situation where most of the people who have this illness now are people who are Australian citizens and living in the community. And that's why this is a bit of a different game. It makes it very hard to know who to test. So the simple answer is you test everyone. So if you get the slightest sniffle, you now get tested. And the really big problem, the reason that Victoria is still weeks away from getting any sort of control of this, is that people still aren't isolating properly. If you get a test, and I've had this happen with patients who I've been seeing who I have a chat to, I examine them, assess them, decide they need a test, and say, look, well, the rule is, now that I give you this piece of paper that says you have to go get a test, you're in isolation as of now. You leave isolation only to go drive and get your test, and then you're back in isolation, not until this test is normal, but until you're well. And that's a concept that I think when I run that through, I hope most of my patients do that. I think they do. And certainly when I've rung them a day or two later to tell them their test result, they're all at home. But it's saying that obviously in Victoria they've been missing because they've reported that up to 90% of people are not doing that. And I want to go through a little bit more about masks. And I've got two things here, two pictures. The one that's on your left is the one that talks about physical distancing, face masks and eye protection. And that was published in The Lancet at the start of June. The Lancet's one of the big medical journals, I think, based in the UK. And that's looking really for, within a health facility, if I want to avoid catching something from one of my patients, the first thing to do is stay a decent distance away. If I can't stay a decent distance away, then I need a face mask and eye protection. And that's a sort of a different setting to the one we're talking about in the general population. If you have a look at the other one, which I've sort of cobbled together from a few different pictures, if you're standing and chatting to somebody who has COVID and doesn't know it, and you've got no face mask on, there's a high chance you catch it. If you've got a face mask on and they don't, so remember the other person's infected, you're not, if you're wearing a face mask, you lower your risk of catching it a reasonable amount. If they're wearing the face mask, so the person who's infected has a face mask on, it's a really low chance you're going to catch anything. And if you're both wearing a face mask, it's very low. So the whole trick with this face mask idea is if the community spread is high enough, then everyone wearing a face mask means everyone is protecting each other. For us at the moment in South Australia, wearing a face mask is not really worth the trouble because the community risk is still very low, and we should be sticking back at that physical distancing spot. So really the rule is still the same. If you can't physically distance, wear a face mask. And if the risk of being exposed to somebody with COVID is high, then everyone should be wearing a face mask. So that hasn't changed. The reason it's changed in Melbourne is at the moment their risk is higher. So then if we leave face masks at the moment to the side for us in SA, what can we do to help? Well, none of them are really any surprise, are they? But the one that really needs to be hammered home is isolate. And again, to talk about Woodcroft, we've heard it through already today. At Woodcroft here, it is safe because we're keeping that distance away from people, and we're keeping away if we're sick, and we've all agreed we're going to do that. So if we're looking at that, I definitely agree that at the moment it's safe for you to be here. If you're at home and listening to this, we'd love to see you. And my Darren's tip for this week is really, and it's been in the talk today as well, is to keep responding with love. I think for us in South Australia, it'd be easy to worry about Victoria, but hassling Victoria is not going to achieve anything for either them or for us. So the better path for us to take is to support them, because it's possible in the next week or two New South Wales goes the same way. And if we're unlucky here in South Australia, then we do as well. Our government's doing everything they can to keep us safe as a state, but as we see from this virus, it's not very easy. So in 1 Corinthians chapter 16, it says, "Watch, stand fast in the faith, be brave, be strong. Let all that you do be done with love." And so for some of us, this is going to be getting pretty draining. I think if you're in Melbourne, and I know I've got one patient who moved to Melbourne about a year ago, who I've spoken to on the phone multiple times now, because he's been locked up in his room for 3 or 4 months now, really, because his work's gone to online. And so it's very isolating. And for somebody like that, a phone call from somebody who cares makes a big difference. And some of us will cope really well with this. I think some of us have probably loved being in isolation at times, a bit of a peace and quiet time. But a lot of people haven't. And I think for all of us, it's going to be really important to remember this is going to go on for a bit longer yet. Hopefully not going to affect us in SA very much. But it's unlikely, Victoria's 2 weeks into it, it's unlikely that it's actually 6 weeks is going to be the total lockdown time. It's likely to be longer. And who knows what comes after this, but I think the overriding message that I'd like to leave people with is to just keep remembering that we're all in this together, and if we respond with love to whatever happens, it's going to be easier for us to get through it together. Thank you very much.